I'm Dr. Michael Lund with Lemire Medical here in Torrance, and one of the questions that's asked of me is what type of filler would you recommend? Well, the most popular fillers that are being used today are made of hyaluronic acid, and we now have both Juvederm and Restylane. There are 5 types of each. There's Juvederm Ultra, Ultra Plus, which were both released in 2007. In 2014, Voluma came on the market, which is a very lifting product. Then we had Volbella, and most recently Volure. Additionally, we also have 5 types of Restylane. So in 2003, Restylane was introduced as the first non-animal stabilized hyaluronic acid filler. And then came Restylane Lift, which at the time was called Perlane, and that uses larger particles, so this would be a product that would lift a little bit more than Restylane did. And then Restylane Silk eventually was released, and that uses smaller particles. Well, in the past year we've had a number of new fillers on the market, and we now have Refyne and Defyne, which use a very specific type of cross-linking technology called aspiration. So that makes these products a little bit more flexible. But another question that providers oftentimes ask me is, are these products aspiratable? In other words, can you aspirate them? If you're doing a bolus injection, meaning that if you're inserting this into the patient and you were to retract on the plunger, would you be able to aspirate to check for blood? And obviously Voluma and Juvederm Volure and even the Hyaluronic products, which are your Ultra and Ultra Plus, are definitely ones that you could do that with. So I'm going to do a little experiment here. This is Restylane Refyne, and we have black coffee. So I've already primed my needle, and we're going to insert this into the coffee cup, and I'm going to aspirate now to see if anything comes back. And so you have no return here. I'll try that one more time. This is using the 30 gauge needle that is supplied with the product. Now, this is not that big of a concern because normally you wouldn't use this in a bolus injection technique method, but I'm just saying for those of you who assume that by aspirating that you're not in a blood vessel, you may be incorrect. I'm going to go ahead and change this needle out for a 27 gauge and see if it makes any difference. So here's a 27 gauge needle. I'm going to prime it, and we'll insert it into the coffee, and I'm now trying to aspirate, and I still get, finally, I got a little something there, okay? So 2 things here. The diameter of the needle makes a difference. So this may not be as cohesive as a Hyaluronic product is, or a Vicross for that matter, but with a larger needle I was able to aspirate using the Restylane Refyne. One other point that is important to note is when you do check for blood return, you need to have negative pressure or aspirate with the plunger for an adequate length of time, say 5 to 10 seconds, to make sure that you're not in a blood vessel. Okay? Hope that helps. Thank you.